this just screws on and off. This is the tube that's connected to him, so you just take that off. And then to take the cartridge out, you just push it up and out.
It's done.
And then if there's insulin in this cartridge, you want to pull the insulin out. But first, so this is the new cartridge. You want to pull all of the air out of the cartridge first to make sure that there's not going to be air bubbles in there. Those are fun to deal with. And then if there's insulin in this, then you would pull it out now. But we don't have any. And then you just roll the insulin a few times and then use an alcohol swipe to wipe the top off. And then you want to make sure you put some air in the insulin bottle. And then it'll come out. And we usually fill it with 2 milliliters.
There, show it. So the 2.
Mm-hmm. And then there's usually some bubbles and stuff in like the needle, so I just flip it upside down and then just kind of hit it, and you can kind of see some of the bubbles floating from out of there up to the top.
Yep.
And you can see the bubbles in here, so I just flick it until all those bubbles are gone. Because this pump is really, it gets quite a few bubbles in it, and we're just trying to avoid any of that.
There, show where you stick it.
So there's this little white thing, and you'll put the needle in, and then the needle will automatically stop. You don't have to worry about any of that. So you just put
Wait,
it.
can I put it in?
No.
Right in there. See, and it just stopped. And then you just slowly push the insulin in. And sometimes your air bubble up here will be big enough that you want to stop before the air goes into the cartridge.
Is it in yet?
All right, and then you can see here, there's like a little window that you can kind of see, and you want to kind of flick it, and then sometimes you can see bubbles, and I like to just pull the insulin out a little bit, and if you see bubbles, so I just pull a little bit out like that.
Really come across, but...
And you can see some of the bubbles coming out of there.
Gotcha.
Because you just want to get as many bubbles. There's the one thing about this, that the bubbles are a pain. Okay, so then you put on the back side, you can see it. It just slides right in there. And then the cartridge is good to go. And then